Third hour of the Elias Macko Show. We start off this hour by taking a look at healthcare in this province. Of course, as of late, the debate between private and public healthcare in Quebec has been an ongoing debate, with many looking at the never-ending healthcare crisis and choosing to go the private route in order to receive faster and more efficient care. And you know, this debate, right? Public versus private. And then when you talk about private, just what private are you talking about, right? Is it private delivery, but paid for by the public purse? Is it coming through your private healthcare plans, through your employer? Things like that. And of course, Quebec is moving towards more private involvement in healthcare, right? They've begun the process of building two publicly funded, privately run mini hospitals. Those two mini hospitals being built in the hopes of relieving pressure on the health network. One would focus on a clinic for geriatric medicine, the other pediatrics. So let's take a look at this situation in the province. Dr. Melissa Vellucci joins us, a family doctor at Clinique Médicale Lacroix in Laval. Dr. Vellucci, welcome to the show.
Hi, thank you very much.
So let's talk about this from your perspective here. And, you know, like, I'm one of the lucky ones because I have a family doctor. I got a family doctor years ago. They're relatively young. I don't have to worry about them retiring. And I've heard from listeners, they had a family doctor, the doctor retires, and now they can't find anyone. So from your perspective, Dr. Vellucci, let's talk about the whole notion of public versus private when it comes to family medicine. What should I know?
So I think the main difference for patients that we get all the time, we get thanked for, is really the difference in the waiting time between public system and private system. My patients, in terms of family medicine for minor emergencies, they can get an appointment the day of. They can call this morning, get an appointment today in the day or tomorrow in the afternoon. For specialist medicine, they also get an appointment within about 2 weeks.
What about how it changes things for you? Like from your perspective, how has it changed your life between the two systems?
So from my perspective, it's changed my life a whole lot. There's a very much better quality of life for the workers, for the nurses, for the secretaries in the front, for the doctors. There's just better organization in general. Like, the main example I could give you is that because we're not understaffed, everybody's doing their task. In the public system, unfortunately, most of the time, doctors are not spending time seeing patients. They're sending out faxes for 20 minutes at the fax machine. We're calling back patients just to tell them an exam report was normal, which a nurse could have perfectly done. At my private clinic, I never spend time doing anything else than seeing my patients, which is really what gives me that opportunity to be present for them in the office, because we have enough staff to cover whatever task they're supposed to be doing. Do
you think the Quebec government could learn a bit from the private system in those respects?
I think they could learn a lot. I wouldn't push for 100% private, healthcare system like in the States, because I still think it's a human basic right to get medical treatment. I think the way the system has been going, especially since the pandemic, there's just no way for the government at this point to get out of this without the help of just the injunction of the private system on the side. With
Dr. Melissa Vellucci, a family doctor at Clinique Médicale Lacroix in Laval. So, and I don't think there's a single soul that wants to have a U.S.-style system, right? Like, we're all like, that's not
exactly,
what,
exactly.
Nobody, and nobody's really talking about that, but we're sort of looking at what happens maybe some European countries and other places that have universal health care. I have to ask you, Dr. Vellucci, so how does it work? Again, as someone that has a family doctor in the public system, and I haven't had to think about this, like, how does it work when it comes to cost? Like, because I would imagine still a majority of the services you offer, that some of it is covered by the public system, but others are not. So what is the breakdown there? And what would someone have to be thinking about as far as costs go if they went the private route?
So for the cost, every consultation, everything you get done at the clinic, whether it's seeing a family doctor, seeing a nurse, getting blood work done, everything is paid out of pocket by the patient. So even if you are covered, unfortunately right now by the RAMQ, the government is not supplying anything. They're not offering any kind of payment option. I would say 80-85% of the patients who do come in, they do already have a family doctor in the public system. Unfortunately, they're not all as lucky as you.
Yeah.
And the family doctor is not always accessible, so they have no choice. If they need something quicker, they have to come see us. At our clinic, the consultations are about $249 per consultation. There's always some promotion sometimes for first-time clients. It could go down to about $199 per patient.
Yeah.
Like I said, they do pay out of pocket. It's income tax deductible. At least some people do have private insurance from their workplace, which is going to cover some part of the cost.
Uh-huh.
But unfortunately, right now, the government and the Régie d'assurance maladie du Québec, they just don't cover anything at all.
Dr. Vellucci, how would you describe, or how would you say, like, who's the typical person that reaches out to you for care? Like, would you say that could be just about anybody? Is it working class people? Like, who comes to your clinic?
I think it's an excellent question to ask because it was a worry of mine before going into the private system. I thought it would be like those super rich, Montrealers coming because they have a lot of demands. It's actually quite the opposite. I've had working class, lower middle class patients. I've had some patients on the Social Security that come with a family member, and all of the family, they just gather up money for that patient to come. So it's really just, I would say it's desperate people who've been desperate trying to get something out of the public system they just couldn't get, and they end up in our office. They will not travel that year. They will not go to the restaurant and just really grab their pennies and come just to get some health care.
And it's just because of wait times, right? Wait times
just because of wait times. Yeah.
Dr. Vellucci, listen, before I let you go, is there anything we didn't touch on today that you think we should touch on here? Is there a point that we haven't spoken about?
I just think in general, in the private system, another difference that there is that we don't have the pressure of the government to see, to have a quota of patients to see. So we do take a lot more time with the patients when they come in. So there's also that extra aspect that when they leave, even though they've paid, they feel very satisfied. They feel like we've covered everything. The amount of patients who told me, I don't remember the last time a doctor took this much time with me or took the time to actually examine me and, palpate me where it was painful. So that's another difference that we have.
Dr. Vellucci, thanks very much for coming on the program and talking about this.
Thank you so much.
I appreciate it. That's Dr. Melissa Vellucci, a family doctor at Clinique Médicale Lacroix there in Laval.